In the absence of any correction, the votes and proceedings of the 34th sitting, dated Tuesday, 28th July 2026, is adopted as the true record of proceedings. I have a copy of the official report of Wednesday, 22nd July 2026. Honorable members, any corrections? Honorable members, there being no correction, the official report of Wednesday, 22nd July 2026 is hereby adopted as the true record of proceedings. Honorable members, I want to know from leaders, do I proceed to item 6, which is questions?
Right Honorable Speaker, the greatest Minister of Health, who this House has unanimously conferred.
Honorable Member, I was a Minister for Health before.
Mr. Speaker, Mr. Speaker,
the record is there for all to see.
The current greatest Minister of Health. So the Minister of Health is here, and so we would like to take his questions now, and then after that we'll take some comments on the budget, and then we'll do the Cocoa Board bill. So we'll start with the questions.
Minister, you may, Deputy Minority Whip, yes.
Mr. Speaker, I don't know by what definition the majority leader is saying that the health minister is the greatest health minister. The current award for sale, he didn't receive some. He was not recognized in the current award, so he was not awarded for anything. I don't know by what definition. Mr. Speaker, to me, you are the best health minister ever. Mr. Speaker, you are the best health minister ever. A health minister who have grown to be a Speaker of Parliament. Mr. Speaker, number 3 of this republic. But, Mr. Speaker, the application of the majority leader, if you look at the questions, we are also expecting the Minister for Environment, Science and Technology. You didn't say anything and then about it, but you're just saying that we are starting with health. But the questions start from the Environment Minister before we get to the Health Minister.
Yes, it's also because I saw the Health Minister in the chamber. The Environment Minister is scheduled to come. So when he arrives and the Health Minister is done, we can also take those questions.
Yes, Minister for Health, you may take your seat. But before we start with the questions, let me, on behalf of the House, acknowledge and appreciate the presence of our August visitors who are with us today. You can see the public gallery is full to the brim. And I have to acknowledge them so that at any time they want, they could leave us to transact other businesses. We have 5 groups of visitors. The first is from Mafi Kumasi Senior High Technical School. It's being led by a teacher by name Bright Kwabla Senya. And they are coming from the Central Tong constituency, and they are 78 in number. On your behalf, I warmly welcome them to the House and urge them to listen patiently, watch what their representatives are doing, learn from us so that in future they could discharge these duties better than we are doing. So you are warmly welcome, and we thank the teacher, Bright Kwabla Senya, for leading you here. Please, you may resume your seats. The second group is from Goodwill Preparatory School, also led by a teacher by name Osam Pinanko Frank. And they are coming from the Ablekuma Central constituency. I'm told there are 55 in number. Please, once again, on your behalf, I warmly welcome them to the House, and the same earlier message I gave to their colleagues apply to them. So please, you are warmly welcome. Resume your seats. The third is from the Generational Influencers Foundation, and they are led by the Chief Executive Officer of the foundation, in the person of Patience Jau, and they are coming from the Upper West Achim area. That is the constituency they are coming from, 39 in number. You are also warmly welcome. Please, you may also resume your seat. We also have honorable member.
Mr. Speaker, they are coming from Lower West Achim, not Upper.
Generational Influencers Foundation.
Yes.
Oh, sorry. What I have here is Upper West Achim.
No, it's Lower West Achim.
Lower West Achim.
Yes, Esamankesi.
Thanks.
They are from my constituency.
Oh, thanks so much for the correction. I'm sure you would have had a hand in bringing them here. Is that the case? Congratulations. But please, the spelling is Achim. It's not Akim. Yes, you have to get it changed.
Thank you, Mr. Speaker.
It's A-K-Y-E-M.
Yes.
Not A-K-I-M.
That is from the Buakwa side.
So from the Abuakwa side, what did they say?
Akim.
No, they've been misled by the white man.
Achim.
It's Achim?
Yes. And
Yes.
the Bosume side, they say Akim.
No, I was in the Achim chambers, and they were from the Abuakwa side, but we're spelling it A-K-Y-E-M. Yes, please. But you are not from the Achim.
Mr. Speaker, the name is Achim,
Yes,
not Akim. It's the brothalization
Exactly.
that is bringing the Akim.
that's what I said. They've been misled.
Ochimang, so Achim.
Yes, they've been misled by the whites, our colonizers. So it's Achim. The fourth group, they are coming from the Accra Girls Senior High School, and they are led by a teacher by name Issa Amadou. They are domiciled in the Ayawaso North constituency. There are 83 in number. You are also warmly welcome, particularly the fact that they are all ladies, and you know how we are making efforts to get gender parity. And so please, on your behalf, I want to thank the teacher for leading them to this place. The teacher happened to be a male, not a female. Am I right? Issa Amadou. Is he there? Oh, yeah, yes, leading from behind. Thank you so much for bringing them here. You are warmly welcome. You may also resume your seat. The last but not the least group, they are coming from Efua Kobi Ampem, Girls Senior High School. They are led by a teacher by name Joseph Kwame Sosu, and they are located at the Achima Kwama constituency. They are 100 in number. That's quite a large number. Teacher Joseph Kwame Sosu, we congratulate you for leading such a large group here. I know your constituency is not in Accra. There must be some cost implications. Is the MP here? He is absent. I would have called on him to take up the cost. Shirley. Where is Shirley? Oh, she is at the, we are having a function at the Aliza Hotel involving a number of the committees. And our members are there. I was there with them. I just left them. So if you don't see her here, it's because she is committed to another duty. No, but you can't represent her at that constituency. Yes, so you are warmly welcome. Please resume your seats. Now, questions. Item 6 on the order paper. We have a few questions for a number of ministers. And we want to start with the Minister for Health. The first question, which is number 336, stands in the name of the Member of Parliament for Trouble, Ms. Gloria Owusu. Honorable Member, oh, that's environment. Sorry, that's environment. We are dealing with health. The first one on health is question number 557. That stands in the name of the Honorable Member for Achimda, which is usually spelled Achim Oda. Honorable Alexander Akwasi Akwa. Honorable Member, you may ask your question now.
Right, Honorable Speaker. Please, I come under Order 88.3, having the authority of the Honorable Member for Achim Oda, with your prior permission to ask the question on his behalf.
Yes, granted.
I'm most grateful, Right Honorable Speaker. Mr. Speaker, I rise to ask the Honorable Minister for Health the steps the ministry is taking to address blood shortage in Ghana and how voluntary blood donation can be encouraged. I thank you, Right Honorable Speaker.
Yes, Honorable Minister.
Mr. Speaker, I thank the Honourable Member for Akim Oda for the question. The Ministry of Health, through the National Blood Service, is addressing the shortage along two main tracks: expanding the capacity to collect, process, and distribute blood, and increasing the number of regular voluntary blood donors. Under the One Region, One Blood Center initiative, the Central Region Blood Center has been designated bringing the number of regional blood centers to 5, located in Accra, Kumasi, Tamale, Ho, and Cape Coast. The number of designated blood collection units has also increased to 43, exceeding the target for the second quarter of 2026. In addition, a 24-hour blood collection service was also introduced at Kolebu Teaching Hospital Blood Donor Clinic on 16th March 2026 to make blood donation more accessible. To encourage voluntary donation, the National Blood Service is intensifying public education in schools, workplaces, faith-based organizations, and communities with support from the media, the National Commission for Civic Education, and the Information Service Department. It is also establishing fixed community collection points, re-engaging senior high schools, encouraging family replacement donors to become regular voluntary donors, and strengthening donor retention, recognition, and appreciation programs. The ministry is further encouraging members of parliament, traditional and religious leaders, corporate institutions, and civil society organizations to organize regular blood donation exercise. These measures are intended to move Ghana from reliance on occasional and family replacement donations towards a stable national system based on regular, voluntary, and unpaid blood donation. I thank you, Mr. Speaker.
Honourable Member, any supplementary question?
Yes, right, Honourable Speaker. Mr. Speaker, I seek to find out from the Honourable Minister for Health. He has indicated in his response that 5 regional blood centers are currently in place, with 16 regions in Ghana. What are the plans of the ministry to expand the regional blood bases and some timelines? I thank you, Mr. Speaker. Mr. Speaker, my question is to the effect that he has indicated that so far.
I heard your question. It's just the last part that it made me clink.
Mr. Speaker, so with your guidance, so the minister can indicate to us plans to expand the number of regional blood
yes,
centers.
Please.
I thank
yes,
you, Mr.
Minister.
Speaker.
Thank you, Mr. Speaker. Mr. Speaker, as I indicated in the answer, Cape Coast is now on board. Given the 16 regions, the target is that we want to at least establish 1 center in each region. So the concept is being developed to seek sources of funding to do that. Thank you.
Any more supplementary?
Mr. Speaker, I'll do a last supplementary. Mr. Speaker, in the minister's answer to voluntary donation, I want to find out from the Honourable Minister if there are some incentives available to motivate people to undergo or voluntarily donate blood. I didn't see any incentive package. I want to find out if there are incentive packages to that effect. I thank you, Mr. Speaker.
Yes, Honourable Minister.
Thank you, Mr. Speaker. Mr. Speaker, there would not be any more incentive done for the people of this country to know the essence of the blood. I think people will be motivated to donate blood when they know the essence of the blood, its importance in saving life in this country. I mean, some motivations such as giving the donor some provisions as some sort of compensation for me cannot compensate the donor enough. But for me, the overriding factor is that we must know the essence of donating blood to save lives in this country. Thank you.
No, Mr. Speaker, no more. I thank you.
Thank you so much. We'll take the next question. The next question is 558. It stands in the name of the same person. And I grant you the permission, as requested earlier, to ask the question on behalf of the Member of Parliament.
Most grateful, Mr. Speaker. Mr. Speaker, before I ask the question, I've checked through the order paper, but the answer to the question is not provided. And per our standing order 82.8, it is expected that the answer to the question would have been communicated and provided and printed in the official report. So it's making it difficult for us to appreciate the response. Okay.
I don't know which order paper you have, but I can see it at page 55. 55 is there. The answer is at page 55 of the order paper.
That is so, Mr. Speaker. I thank you. Okay. So, Mr. Speaker, I rise to ask the Minister for Health to provide an update on the implementation of the plans of the Mental Health Authority to expand access to mental health services and reduce stigma. I thank you, Mr. Speaker.
Yes, Minister.
Mr. Speaker, the Mental Health Authority is expanding access to care by integrating mental health services into primary health care. Community mental health officers are being equipped with training, supervision, and digital tools to extend services, particularly to rural and underserved communities. The authority is also expanding tele-psychiatry and virtual clinics to address geographical barriers and the shortage of specialized personnel. In addition, psychiatric services are being progressively integrated into regional and selected district hospitals to demonstrate to decentralized care. Workforce development is also being strengthened through training, career development opportunities, and pathway for specialization in psychiatry and mental health nursing. To reduce stigma, the authority continues to build on the criminalization of attempted suicide in 2023 through public sensitization that promotes treatment and support rather than punishment. Public education is being undertaken through traditional and social media, school outreach programs, and partnership with faith-based and traditional leaders. The authority is also promoting community dialogue and peer support through initiatives such as the National Bereavement Program, support groups, and digital peer support platforms. These interventions are intended to encourage early help seeking, normalize conversations about mental health, and strengthen community support for affected persons and their families. Mr. Speaker, I thank you.
Honourable Member, any supplementary question?
Thank you very much, Right Honourable Speaker. Mr. Speaker, the Minister has indicated that steps are being taken to build on the decriminalization of attempted suicide in 2023 through public sensitization. I want to find out from the Honourable Minister what practical steps have been taken to decriminalize attempted suicide as indicated here. I thank you, Mr. Speaker.
Yes, Minister.
Mr. Speaker, if my memory serves me right, decriminalizing suicide has been passed in this House. So it's a matter of public education for people to know that it's been decriminalize and sensitize the people about how they can help people in need rather than punishing them. Thank you.
Actually, Minister, you haven't answered the question. He wants the practical steps. This is the concept. This is what should be done. But he wants to know the steps that you've taken to implement what you have said now. Because your answer is that the authority continues to build on the discriminalization of attempted suicide in 2023 through public sensitization. So what are those public sensitization? Which is to promote the treatment and support. So he wants you to identify them.
Thank you, Mr. Speaker. Mr. Speaker, this is basically through, engagement on the radio stations and working with religious leaders, using their platforms in the churches, in the mosque, information centers in our communities, for people to appreciate the fact that if somebody has a mental health issue, it's not a matter of punishing the person or stigmatizing the person, but they need our help and support. Thank you.
Honourable Member, any more?
No, Mr. Speaker, I thank you, and I want to thank the Honourable Minister.
Thank you so much. May we now take the next question, and that is question number 660. Stands in the name of the Honourable Member for Offenson of Dr. Fred Che Asamoah. Honourable Member, you may ask your question now.
Thank you, Mr. Speaker. I rise to ask the Minister for Health what steps the ministry is implementing to ensure compliance with the World Health Organization's good storage and distribution practices of pharmaceutical and other health products.
Minister, I hope you heard him, so you may read your answer.
Mr. Speaker, the Food and Drugs Authority has amended the Public Health Act of 2012, Act 851, has established guidelines on licensing of medical products storage facilities. These guidelines are designed to ensure the safety, quality, and efficacy performance of medical products. The FDA's guideline is aligned with the WHO's recommendation and are applicable to all businesses in the storage and distribution of medical products. The FDA routinely inspects and licenses these facilities and also conducts continuous training of pharmacists, supply chain managers, warehouse staff, and logistics officers on WHO good storage and distribution practices to enhance the capacity of personnel. These activities collectively support a resilient, transparent, and efficient health supply chain capable of delivering quality-assured medical products to all levels of the healthcare systems in Ghana. Thank you.
Honourable Member, any supplementary question?
Thank you, Mr. Speaker, and thanks to the Minister for his response. Mr. Speaker, may I ask the Minister what measures the ministry is or has in place to identify the unlicensed storage and distribution outlets, particularly within our rural areas? Within the cities is done. So what measure do you have in place?
I'm assessing whether this is really a supplementary question. But if the Minister has the answer, he could share with us. Maybe he has the information.
Thank you, Mr. Speaker. Mr. Speaker, the FDA intermittently conduct inspections. So they do outreach programs, so in some cases based on tip-offs, to inspect these places, whether they are appropriate places for storage and distribution. If they are not, they bring those who are engaged in that to order. Thank you.
Yes, honourable member.
Thank you, Mr. Minister. Mr. Speaker, I would like to go further. In terms of the licensed storage and distribution facilities that you talked about in your answer, could you give us an idea what percentage of these facilities were found compliant with the WHO standards as attributed?
Yes, Minister.
Mr. Speaker, I don't have the specific figure at hand now. I may provide the House subsequently. Thank you.
Honourable member, you can follow up on that matter. Yes. Any more?
Mr. Speaker, thank you very much. I hope the minister will provide the answer to us later, but for the good of the public health. But Mr. Minister, I did talk about training of pharmacists and logistics officers and warehouse staff. Could you give us an idea how often this training do happen? And if in case you have idea how many pharmacists have been trained on this logistics and warehouse management based on the WHO guidelines?
Yes, Minister.
Yeah, Mr. Speaker, the FDA, as I indicated, routinely inspect and then license these facilities. And so before these facilities are licensed, as part of the criteria to license your facility, you must have the required skilled people to be able to man the place. And so it's one of the criteria. There are a lot of factors to consider to accredit a facility as a storage facility that meets WHO. So as part of the criteria, they inspect and then train the people up to standard. And then those who are even trained already, as part of renewing their licenses, it's part of their development, continuous development career. Thank you.
Honourable members, he's finished his. Yes, you have. Yes, you may do so.
Thank you, Mr. Speaker. Mr. Speaker, reading the minister's answer to the question, Mr. Speaker, I want to find out. The minister said FDA routinely inspect and license these facilities and also conduct continuous training of pharmacists, supply chain managers, warehouse, blah, blah, blah. I want to find out from the minister, do they have a sanction or some sanction regimes that are being meted out to these warehouses that violate the storage standards? I want to find out. Mr. Speaker, thank you.
Yes, Minister.
Mr. Speaker, the answer is yes, there are sanctions.
Yeah, Honourable Member, you may refer to the law itself. You see they are stated there, the sanctions. May we now move to the next question? Question number 698 stands in the name of the Honourable Member for Swami, Honourable John Darko. Yes.
Speaker, I thank you very much. I rise to ask the Minister for Health what engagement the ministry has undertaken with Zipline concerning the operation of the medical drone delivery services and the steps being taken to ensure the continuous and effective operation of the medical drone delivery services for essential health supplies. Thank you, Mr. Minister.
Yeah, Honorable Minister, you may answer the question, but first Deputy Speaker to take the chair. First Deputy Speaker to take the chair.
Oh.
I have an interview to attend to. I've been given a time. Oh, he's one of your best friends. Yes, Minister, you may go on.
Mr. Speaker, the Ministry of Health, representing the government of Ghana, signed a service agreement dated 11 December 2018 with Fly Zipline Ghana Limited, a company incorporated in Ghana for the emergency delivery of blood and health products to selected public health facilities from 4 distribution centers across Ghana for a period of 4 years. Mr. Speaker, the Ministry of Health and Zipline on 15 December 2020 amended the agreement and extended the service period from 4 years to 8 years and expanded the scope from 4 distribution centers to 8 distribution centers based on the amendment. The agreement is expected to expire by September 2027. The Speaker, until recently, Zipline has been operating from 6 distribution centers as follows: Omenako Suhum in Eastern Region, Mpenya Mampong in Ashanti Region, Vopsi Walewale in the Northeast Region, Sahioso in Western North Region, and Anum Boso in Eastern Region, Ketekrache in Oti Region. Mr. Speaker, as at March 2026, the Ministry owed Zipline, though some payments have been made to Zipline lately. The Ministry has taken steps to mobilize the necessary funds to pay the outstanding money. Mr. Speaker, the Ministry held several meetings with Zipline to explore opportunities for amicable middle grounds for moving forward. However, in October 2025, Zipline unilaterally decommissioned 3 distribution centers and currently operating only 3 distribution centers as follows: Omenako, Mpenya, and Vopsi in the Walewale in Northeast Region. Mr. Speaker, the Ministry is currently engaging Zipline to ensure that services focused on filling the identified gap is in emergency medicine supply and hard-to-reach areas are geographically cut-off areas in case of natural disaster. Thank you, Mr. Speaker.
Honorable, any supplementary question?
Yeah, thank you very much, Speaker. Minister, you said the agreements will expire in September 2027. Will the government, or would you advise the government, to further extend the agreement when it expires in 2027?
Yes, Minister.
Mr. Speaker, I will do so based on some observations that has brought to my attention in the Ministry. Thank you.
Any further question?
Thank you very much, Speaker. Minister, in your answer to the House, you have indicated to us that the zip lines in Serioso, in Western North, Anum Boso in Eastern Region, and Ketekrache in Oti Region have effectively come to an end. Is that the case? Is it the case that the operations in these areas, including your region, have come to an end or have been closed down?
Yes, Honorable Minister.
Mr. Speaker, I didn't say they have come to an end. That is his language. They have been decommissioned. Thank you.
Thank you, Speaker. Minister, in your answer, you have also said that and I quote from your answer, you said the ministry is currently engaging Zipline to ensure that services focus on filling the identified gap in emergency medicine supplies and the how-to-reach areas. So I want to find out, the how-to-reach areas will include the Western North region, Eastern region, and Uti region. These are the how-to-reach area. Will you advise or will you enter into partnership for Zipline to open their services in Western North and the regions I just mentioned?
Yes, Honorable Minister.
Mr. Speaker, the rationale behind the deployment of Zipline is 1, the hard-to-reach areas. 2, emergency services. Mr. Speaker, for the information of the House, per the review of the services of Zipline, what they are doing currently, they are touching on the services they are delivering. Only 10% constitute hard-to-reach area. Only 4% constitute emergency. What it means is that more than 80% of the services they are delivering at this point in time is not targeted at the core reason why Zipline was brought on board. And so that is why I am saying that we identify them, we are engaging them so that they will be refocused on the rationale behind bringing them. Thank you.
Yes.
Thank you, Mr. Speaker. Mr. Speaker, I would like to ask the minister, would he say that Zipline's activities in this country has been successful, and what are the key areas that he considers a success for the Zipline operations?
Yes.
Mr. Speaker, success is subjective. I have clearly indicated on this floor that they are not performing more than 20% of their core responsibility. How will I describe this operation as being success? Thank you.
Honourable members, we have a lot of businesses. So let me distribute the questions. Now you have the floor. Let's resume. No, you. Yes.
Thank you. Thank you, Mr. Speaker. Mr. Speaker, I want to find out from the minister. He said Zipline unilaterally decommissioned some services. I want to find out from the minister, what are the effects of decommissioning some of these services to those areas?
Yes, Minister.
Mr. Speaker, measures have been put in place to fill that gap. And so, for me, if you ask me as I speak, there is no much vacuum created. Thank you.
Yes, Honorable Safoji.
Thank you, Mr. Speaker. Mr. Speaker, I want to find out from the minister if there have been some budgetary allocation to engage the Zipline to ensure that they move from their 20% performance and up it because of the
I think you want to tempt me with your question.
Services they render.
You want to tempt me with your question. Honorable Chair Sama.
Thank you, Mr. Speaker, and I don't intend to tempt you with my question.
So then you must respect the standing order.
Mr. Speaker, thank you. Mr. Speaker, may the minister give us an idea of the cost implication to government for extending per the answer?
You are also trying to tempt me. Read the question.
Mr. Speaker, I'm going to the question, the answer to the question. He talked about extending the distribution centers to 4 additional centers, making it 8. Then, of course, extending the 4-year contract to 8 years, additional 4 years, making it 8 years in total. So I would want to know the cost.
The question is on steps being taken to ensure the continuous and effective operation of the medical drone delivery service for essential health supplies. So, my brother, if you want to know the cost that is involved, pose the question. The minister can't look for the answer and bring it to you. Supplementary question is not cross-examination question. It is not the examination question. That's why ministers come here with a prepared answer. So if the question is not dealing with cost and you are asking question about cost, are you being fair?
Mr. Speaker, respectfully, if we are talking about the steps that you take to be able to achieve the 4 additional centers and the 4...
With all due respect, your question is overruled. All right, members, let's move to question number 699. Standing in the name of Honorable Kobina Muatin, Member of Parliament for Ejisu, you may now ask your question.
Mr. Speaker, I come under Order 883 and having the authority of the Honorable Member of Ejisu.
Please ask.
I'm grateful, sir. You're waiting for. Mr. Speaker, I rise to ask the Minister of Health progress of work done at ongoing psychiatric hospital project at Orin in the Ejoso municipality.
Yes, Honorable Minister.
Mr. Speaker, I wish to mention that the psychiatric hospital project at Ome in the Ejoso municipality is included in the Agenda 111 initiative. As you may be aware, the necessary stakeholder consultation on Agenda 111 program have been completed. A cabinet memorandum outlining the full strategic implementation plan has been developed and forwarded to cabinet. Following these consultations, it was agreed that the ministry would adopt a phased approach to completing the projects, taking into account their level of completion, availability of funding, and the healthcare needs of the respective catchment area. This approach is intended to ensure the efficient use of limited resources by focusing on the completion and operationalization of these projects. Accordingly, the ministry has prioritized 35 projects for implementation under the first phase of the program. The Speaker, the psychiatric hospital project at Onwe is currently at approximately 33.77% completion. Although it was not included in the 35 prioritized projects, the government-phased implementation approach provides an opportunity for the project to be considered for completion in subsequent phase of the program. Thank you, Mr. Speaker.
Honourable Member, any supplementary question?
Thank you, Mr. Speaker. My question is there any assurance that in subsequent projects it will be added on?
Yes, Honourable Minister, any assurance? He's asking of assurance. Assurance for the subsequent phases.
Yes, Mr. Speaker, we have taken 35. We are implementing 35. When we are done, based on availability of funds, we'll package another batch for completion. Thank you.
Honourable members, let's move to question number 700, standing in the name of Honourable Emmanuel Ntakuni, Member of Parliament for Pru West.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister for Health the immediate plans the ministry has to complete the Agenda 11 District Hospital in Prime. Thank you.
Yes, Honourable Minister.
Mr. Speaker, the District Hospital in Pran, in the Bono East region, is one of the Agenda 111 initiatives. As I have indicated earlier, the necessary stakeholder consultation on Agenda 111 program have been completed. A cabinet memorandum outlining the full strategic implementation plan has been developed and forwarded to cabinet. Following these consultations, it was agreed that the ministry would adopt a phased approach to completing the projects, taking into account their level of completion, availability of funding, and the healthcare needs of the respective catchment area. This approach is intended to ensure the efficient use of limited resources by focusing on the completion and operationalization of the project. Accordingly, the ministry has prioritized 35 projects for implementation under the first phase of the program. Mr. Speaker, the district hospital at Prang is currently at approximately 25.323% completion. This will be considered under subsequent phases of the implementation program. Mr. Speaker, the government remains fully committed to the completion of all the Agenda 111 projects across the country, and the phased approach is intended to ensure that limited resources are used efficiently to complete and operationalize projects. Thank you, Mr. Speaker.
Honourable member, any supplementary question?
No, Mr. Speaker. Thank you.
Thank you. This is consensus specific. We'll move to question number 772, standing in the name of Honourable Frank Yabua, Etuma Mobiaja North. You may ask your question.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister for Health the plans the ministry has in recruiting nurses who have completed the mandatory service and the batches or year groups that are next to be recruited. Thank you.
Yes, Honourable Minister.
Mr. Speaker, progressively, recruiting health professionals into the public health sector remains a priority for the ministry. As such, the ministry has developed a comprehensive medium-term recruitment plan for the health sector, covering 2026 to 2028. This year, we are recruiting 16,000 health professionals for distribution across the country, especially to the underserved areas. In the nurses and midwives category, we are prioritizing the recruitment of the 2021 batch, with the first phase almost completed. Interviews at the various district levels have been completed, and professionals are currently reporting at their various permanent workstations. The second phase of the recruitment process will be undertaken before the end of this year. The 2022 batch of nurses will be the next to be considered, and the 2023 batch of nurses will continue in that order. The Ministry of Health remains committed to the progressive recruitment of qualified health professionals to strengthen healthcare delivery across the country, subject to the availability of financial clearance. Subject to the availability of financial clearance from the Ministry of Finance and guided by the staffing norms of the ministry. Thank you.
Honourable member, any supplementary question?
Thank you, Mr. Speaker, and thank you, Minister. In your answer, you mentioned that you are recruiting 16,000 health professionals this year, that's in 2026. May I know the number of nurses and midwives that are included in these 16,000? Thank you.
You are talking about the classification?
Yes, Mr. Speaker, just the nurses and midwives.
To classify it?
The number included the 16,000. He just mentioned that they are recruiting 16,000 health professionals. And my question is...
Very well, very well.
Thank you.
Yes, sir.
Mr. Speaker, for the sake of clarity, I said we are doing 16,000. We have been given clearance for 8,000, and we have concluded, we are almost concluding on the 8,000. Now, if you ask me the number of nurses and midwives in the 8,000, because we have concluded, I'm able to tell you. But I cannot tell you the number in the 16,000 because we have not concluded on the 16,000. In any case, the number in the 8,000 is 6,500. Thank you.
Oh, Honorable Kwajo Nkrumah, I'm surprised. You of all people. Any further question?
Yes, Mr. Speaker. Can the minister tell us the number of qualified nurses and midwives that are yet to be recruited outside the 6,500?
Honourable Member, your question is clear. You are asking the Minister of Health the plans the ministry has in recruiting nurses who have completed mandatory service and the batches or year group that are next to be recruited. So he is prepared to come and answer that particular question. And you are saying, what is the number that has not been recruited?
Mr. Speaker, thank you for your guidance.
I think he wrote mathematics question long ago.
Mr. Speaker, I understand where you're coming from, but my understanding is that you cannot prepare for a group of people without knowing the number. So if you are preparing for them in terms of budget and the rest of it, how do you prepare if you don't know the number?
But your question doesn't demand that.
I ask the plans you have.
If I ask you to come and tell me the number of people that you have recruited, and you've come to tell me this is the number, and I'm telling you what is the number that are not recruited, this is a matter that you need to refer to the record to come and answer. Do you agree with me? That you must refer to the records to come and answer.
Mr. Speaker, you can come from that angle, but I was thinking that because he's a minister, we must have the data of all the qualified nurses that are to be recruited in the country.
I indicated here that ministers come here with a prepared answer. So you give him the notice of the question, you prepare the answer to come and give you, but not to take him by surprise.
So I should take it to mean that the minister doesn't know the number.
If you have another question, ask.
Thank you very much. There's no question. Thank you.
We move to question number 773. Standing in the name of Dr. Gideon Buako, Member of Parliament for Tano North. You may ask your question.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister for Health what plans the ministry has in place to upgrade Yangfo and Tanoso health centers and polyclinics to a hospital status in the Tano North constituency. Thank you, Mr. Speaker.
Yes, Honorable Minister.
Mr. Speaker, the Ministry of Health is fully aware of the healthcare needs of the people of Nyamfo and Tanoso in the Tano North municipality. With respect to the Nyamfo Health Center, I've been reliably informed that Newmont, Ghana is currently constructing a new health facility for the community, which is approximately 70% complete. Upon completion, the facility is expected to be upgraded to polyclinic and equipped to provide a broader range of healthcare services to the people of Nyamfo and its surrounding communities. The Speaker, regarding the Tano Health Center, there are currently no plans to upgrade the facility to a polyclinic in 2026. However, the ministry will undertake the necessary assessment and, subject to the availability of resources, consider the proposed upgrade under a subsequent budget. Mr. Speaker, the ministry remains committed to improving equitable access to quality healthcare across the country and will continue to work with relevant stakeholders to strengthen healthcare delivery in Yamfo, Tano, So, and other underserved communities.
Any supplementary question?
Mr. Speaker, we are grateful to Nemo Ghana Company Limited for providing the people of Yamfo with the health facility. But given that what Nemo is building is a completely new facility and at a new location.
Honourable member, you know me, I stick to the rules.
Yes, I'm asking the question.
Respect
Mr. Speaker,
Order 88.7.
Mr. Speaker,
What is your supplementary question?
my supplementary question is that what plans does the ministry have for the existing health center at Yamfo? If Nemo builds the new one, what plans does the ministry have for the existing one?
Yes, Minister. Though you've indicated it, you can repeat it for him.
Mr. Speaker, it must be on record that it does not necessarily require that every health facility be upgraded. Yes, listen to me. The ministry deliberately creates chief's compound and they are for that purpose. They deliberately create health centers and for that purpose. So at every level, if we consider within the catchment area, there's a need for a health center, we build a health center. It doesn't mean that the health center must be upgraded to a district hospital. If you need a district hospital will be provided, and that health center will remain a health center. What you need may be retooling of the facility, which we are already doing. Thank you.
Yes.
Thank you, Mr. Speaker. Mr. Speaker, I want to ask the minister, can the chiefs and people of Tanoso have the assurance of the honorable minister that the Tanoso Health Center upgrade will be captured in the 2027 budget, given the necessity and the fact that Tanoso hosts the Tanoso Midwifery and Nursing College, which is one of the largest nursing colleges in the Ahafo region? Thank you, Mr. Speaker.
Well, Minister, you may answer the question. Remember, we have government assurance.
Mr. Speaker, I have not said we are going to upgrade it. We are going to do the assessment, and the decision will be based on the assessment. Thank you.
Any further question? Do you have any further question? So please, let me know whether you have a further question so that I can give the floor.
I do not have any further question.
Very well. Yes. We move to question number 774, standing in the name of NSEAO, Enim, Member of Parliament for Kumewu.
Thank you, Mr. Speaker. I rise to ask the Minister for Health if the ministry has engaged with development partners, including the Global Fund and PEPFAR, to mobilize funding for the procurement of lenacapavir once approved, and what budgetary provisions have been made.
Yes, Honorable Minister.
Mr. Speaker, lenacapavir, an injectable and represents a first-in-class pre-exposure prophylaxis having a novel mechanism of action and a long half-life, making it ideal for infrequent dosing. It is indicated as a prevention for adults and adolescents clients who are HIV-1 negative and perceive themselves to be at risk of acquiring HIV. Lenacapavir has been included in the National PrEP guidelines as one of the long-acting injectable antiretroviral medicines as part of the policy guideline readiness and preparation for its introduction and use in Ghana. Additionally, the lenacapavir has been quantified and included in the GC8 funding proposal, which has just been submitted to the Global Fund for review and consideration. It is anticipated that it will be available for use in Ghana in the second half of 2027 through the global funding mechanisms. However, government will continue to explore other funding opportunities, particularly domestically, to augment the global funding mechanisms for its introduction if funding becomes available. Thank you.
Any further question?
Yeah, thank you, Mr. Speaker. So, Minister, as you did indicate, you've engaged the Global Fund, but then when you look at the first country within Africa that received...
Honorable Member, supplementary question.
Supplementary. So the second part of the question, which talked about budgetary provisions being made by the ministry, I just want to find out from Minister if the ministry has made any allocation against the budget for 2027 in the healthcare, since you have indicated you are exploring domestic solutions. We know that in other African countries, they have explored domestic funding for this. So are they concrete budgetary allocation against 2027? Since you've indicated in your response that for the second half of 2027, we are expecting it in the country. So can we know if there are any definite plans by the ministry to allocate this in the budget for 2027?
Yes, Minister.
Mr. Speaker, once Global Fund approves it, usually they come with co-funding and we'll make appropriate allocation for that. Thank you.
Any further question?
Yes, Minister, in your response now, you did indicate that there can be co-funding, but then we have also learned about how Eswatini, Nigeria...
Honorable Member, you are completely out of order. Ask supplementary question.
Thank you, Mr. Speaker. Minister, I just want to find out, are there plans that if Global Fund fails to support government in the second quarter of next year, government is looking at any other source to fund this importation of Lina into Ghana?
Yes.
Mr. Speaker, yes, we are looking around for sources of funding, but we have not found one yet.
Honourable Member, with all due respect, you have asked 3 supplementary questions. So I'll give the floor to Honourable Chair Samoa.
Mr. Speaker, I've asked only 2.
Chair Samoa, you have this thing. You have the floor.
Thank you, Mr. Speaker. I'm going back to the question. Mr. Speaker, the questioner asked the minister, what budgetary provision have you made? Since this question is the original question, I would like to ask the minister, the budgetary provision, can he give us an idea, the amount or the quantum, even though they might be looking for funding, can you give us an idea of the quantum of budgetary provision that would be needed for this procurement?
Honourable Minister.
Mr. Speaker, given the processes, it will be premature to announce any specific amount because it goes through the Global Fund. So, for example, if we say we need 10, and then Global Fund says we can afford 4, then we know we are looking for the 6. So there's a process that we are undergoing. So we are not at where we can specifically determine how much will be required. Thank you.
Honourable members, let's move to question number 775, standing in the name of NS Yao Enim.
Thank you, Mr. Speaker. I rise to ask the Minister for Health what regulatory steps are being undertaken to fast-track approval and registration of lenacapavir for use in Ghana.
Yes, Honourable Minister. Question number 775.
Mr. Speaker, the Food and Drugs Authority, Ghana, received one application for the registration of generic lenacapavir product in May 2026. Given the public health importance of the product, the application was accorded fast-track priority and was evaluated accordingly. The authority completed the initial assessment by the end of June 2026. And on 2nd July 2026 issued a deficiency letter requesting the applicant to submit additional information and supporting data necessary to complete the evaluation of the application. As of 27th July 2026, the applicant has not submitted a response to the authority's queries. Consequently, the evaluation process remains pending until the requested information is received. In line with the FDA's fast-track procedures, once the applicant submits the outstanding response, the submission will be accorded fast-track review to facilitate the timely completion of the assessment and the regulatory decision. Thank you.
Any further question?
Thank you, Mr. Speaker. Minister, I just want to know if the ministry is collaborating with other partners to facilitate with the manufacturers to get these Lena vaccines into the country.
Yes, Minister.
Mr. Speaker, this question is about, first and foremost, registering the products in Ghana. That is what the question is about. And therefore, I've assured you that we are going through the processes of, first and foremost, registering it so that the product can be used in Ghana. If you don't register the product in Ghana and you don't go through the procedures, you cannot even use the product in the country in the first place. Thank you.
Any further question?
Yes. Thank you, Mr. Speaker. Minister, I want to know if the ministry has plans to update the HIV prevention guidelines and also to train medical officers in the administration of Lena once the dose is approved. Yeah.
Can you ask the question, split the question for the minister?
Thank you, Mr. Speaker. So I just wanted to find out from the minister if the ministry has plans to update the HIV preventive guidelines and also to train health officers in the administration of the Lena once it is approved and it comes into the country.
Your question is 2 in 1. That is why I asked you to split it, but I'll give the floor to the minister.
Mr. Speaker, the answer is yes. Thank you.
Any further question?
Thank you, Mr. Speaker. My final question, Minister, I just want to find out, is the FDA open to opening up the registration for a lot of pharmaceutical companies to also bring in this Lena vaccine for registration?
Yes, Honorable Minister.
Mr. Speaker, we haven't restricted any body from bringing the application. So once you bring the application and you go through the due process, why not?
Thank you, Mr. Speaker. Minister, my final thing
is... Please, you've asked 3 questions.
Speaker,
should I repeat the questions for you?
This is a great step.
This is the second time you are doing this. You have asked 3 questions and you want to behave as if You have not asked 3 questions. We are honorable members. We need to do the honorable things. I can repeat all the 3 questions for you. All members, let's move to question number 791. Standing in the name of Honorable John Kwame Edu, you have the floor.
Most grateful, Mr. Speaker. Speaker, I have the authority of the member concerned to seek your permission to ask the question on his behalf.
I don't grant permission.
Speaker, I have the authority.
The question is not for me. How can I be permitting you to ask the question?
I have the authority of the member.
Very well. If you have his authority, ask.
Precisely what I said, Speaker.
Yes.
Thank you. I rise to ask the Minister for Health what the ministry is doing about the Doma Central Constituency ambulance that has not been working for over 2 years now as a result of engine breakdown, to get it functioning again or replaced to serve the people in the constituency. Thank you.
Yes, Honorable Minister.
Mr. Speaker, the Minister of Health acknowledges the concern raised by the Honorable Member for Doma Central and appreciates the opportunity to respond accordingly. Mr. Speaker, I am pleased to inform this august House that the ambulance assigned to Doma Central constituency with registration number GV320, which had been off the road due to a major engine fault, has now been fully repaired and restored to active service. Mr. Speaker, the National Ambulance Service secured a replacement engine and engaged its mechanics to carry out the installation and all related repair works. These repair works were completed successfully and the ambulance has since been returned to service. Mr. Speaker, I wish to report that the Doma Central Ambulance has been back in commission and providing pre-hospital emergency medical care to the people of the constituency since Monday, 20th July 2026. The ambulance is currently being operated by a staff strength of over 21 emergency medical technicians who are on hand to ensure prompt and reliable emergency response services within the constituency. Mr. Speaker, the Ministry of Health and the National Ambulance Service remain committed to ensuring reliable and timely pre-hospital emergency medical services throughout the country. The ministry wishes to assure the honorable member and the people of Doma Central that the ambulance is now fully operational, adequately staffed, and available to serve the constituency, and the National Ambulance Service will continue to monitor its performance to ensure sustained and dependable service. Thank you, Mr. Speaker.
Yes, any supplementary question?
Speaker, no, really, I can only appreciate the minister's commitment and industry. Thank you.
Members, let's move to question number 152, standing in the name of Dr. Kinsley Ajimai, Ebuakwa South.
Thank you, Right Honorable Speaker. I seek to ask the Minister for Health what concrete steps the ministry is taking to ensure timely reimbursement to health service providers under the National Health Insurance Scheme to prevent future disruptions that directly impact vulnerable citizens.
Yes, Honorable Minister.
Mr. Speaker, I thank the honorable member for Ebuakwa South for the question. The most significant step government has taken to ensure timely reimbursement of healthcare providers is the lifting of the spending cap on the National Health Insurance Fund. This has made additional resources available to the fund, and together with the monthly transfer of National Health Insurance levy proceeds by the Ministry of Finance, improved its liquidity and predictability. The improved flow of funds has enabled the National Health Insurance Authority to prioritize claims and maintain a regular monthly payment cycle, with the most recent payment made on 30th June 2026. This provides greater certainty to healthcare facilities and support the uninterrupted provision of medicines and services to the National Health Insurance Scheme members. The authority has also directed providers to submit claims within 3 months of providing services. Claim submissions and processing are now electronic and paperless, reducing manual delays and improving turnout times. Integration of the electronic claims processing system with the Ghana Integrated Financial Management Information System is also nearing completion to shorten the period between claims approval and payment. Mr. Speaker, service and medicine tariffs have also been reviewed because reimbursement must be both timely and reasonably aligned with the cost of care. The uncapping has therefore addressed the principal financing constraint, while the digital and administrative reforms are improving the efficiency of payment and protecting continuity of care for vulnerable citizens who depend on the national health insurance. Thank you, Mr. Speaker.
Any supplementary question?
Thank you, Right Honorable Speaker. Minister, you did indicate that you made a recent payment as recent as end of June. May I respectfully know the period the payment covered? Thank you.
Yes, Minister.
Mr. Speaker, it covers up to April, the end of April. Thank you.
Any further question?
Yes, please. It covers up to the end of April, which means first quarter of this year has been paid. Which means first.
Should I give that to the minister as your question?
No, I'm coming, please. I'm trying to do something. But my next question is, if the period paid is up to the end of April, does it mean that you have paid for the first quarter of this year? Thank you.
Yes, Minister.
Mr. Speaker, the issue about payment of claims is no more availability of funds. The funds are available with the National Health Insurance Authority, but then there cannot be any payment if the processing of the claims have not been completed. And so it is not an issue of availability of funds. The fund is secured, and as and when service providers submit their claims and it goes through the processes, they will do the onward disbursement. So what they have submitted and it's been concluded is what they have paid. If you bring it tomorrow and the next day is processed, the third day you'll be paid. Thank you.
Any further question?
Yes, please. I'll make an advancement. You did indicate in your response that you are doing synchronization of gift mix with the claims processing system. What is the expected completion date, please?
Yes.
Mr. Speaker, as soon as possible.
Honourable members, let's move to question number 157. Standing in the name of Dr. Kisili Ajimai. You have the floor.
Thank you very much, Right Honorable Speaker. I further seek to ask the Minister for Health why Ghanaians, including Her Excellency, the Vice President, Professor Jenana Opoku-Agyeman, often seek medical treatment abroad, and what the ministry is doing to improve specialist healthcare services so that government officials and citizens alike can receive quality healthcare locally.
Yes, Minister.
Mr. Speaker, the quality of health service in the country continues to improve with time. While we are working towards achieving universal health coverage by 2030, using the primary health care strategy, specialist care services are also being improved. The ministry has adopted the whole of government, whole of society approach in improving specialist services by encouraging, promoting public-private collaboration in providing specialist health care services. Mr. Speaker, it may interest you to note that the regulatory environment for health is continuously being strengthened for better quality of care at all levels. The ministry, through the Health Facility Regulatory Agency, is currently undertaking a national assessment of all health facilities in Ghana. The essence is to ascertain service availability and readiness of these facilities to provide high-quality health service delivery to the good people of Ghana. Mr. Speaker, the ministry, through the colleges of health, continue to train specialists to complement the health workforce, while efforts are also being made by government to improve on the health infrastructure for advanced medical care. The ministry is also working with the private sector, CHAG, and the self-financing service delivery facilities to assess the specialist service available and to catalog and specialist facilities in the country and the services they provide. As Ghana positions itself as a medical tourism hub within the region, the specialist services we are providing will also be to benefit our population. We are in the process of completing the medical tourism policy strategy that will also guide high-quality medical specialist service provision in Ghana. This will include attracting and partnering with interest parties to come and establish specialist health facilities that will attract international patients, similar to what we are in the pharmaceutical, what we are seeing in the pharmaceutical manufacturing and educational sector. Thank you.
Member, any further question?
Thank you very much, Right Honorable Speaker, and thank you, my colleague. It is good to know that we are making strides in specialist health care. But evidence or empirical evidence suggests that...
Honorable Member, you are out of order. Please ask a supplementary question.
I'm trying to lay a foundation.
Please ask a supplementary question.
So when will Ghanaians stop going abroad for specialist health care?
Hold it. I still maintain that we need to obey the rules. Let me once again read Standing Order 88.7. It says, a member in asking a question shall not address the House, raise any argument, or offer an opinion. Which rules did you stand to lay the foundation by doing what you are doing? So this is the rules that guide asking of a question. So proceed to ask question.
Thank you very much, Right Honorable Speaker. Minister, in the last paragraph of your response, you did indicate that you are in the process of completing medical tourism policy and strategy. Please, when do you intend to complete it? Thank you.
Yes, Minister.
As soon as possible. Thank you.
Any further question?
That will be all. Thank you.
Yes.
Thank you very much, Right Honorable Speaker. Minister, in your answer, you said the ministry through HEFRA is currently undertaking the national assessment of all health facilities in Ghana. Please, I would like to find out from you, has HEFRA been given some timelines? Has HEFRA been given some timelines and KPIs to work within?
Yes,
Thank
Minister.
You.
Mr. Speaker, the truth of the matter is that they are even done with the assessment, and so we know the gaps already. Thank you.
Honourable members, let's move to question number 160. Also standing in the name of Dr. Kingsley Agyemang.
Thank you very much, Right Honourable Speaker. I seek to ask the Minister for Health how the lifting of the spending cap on the National Health Insurance Fund will impact the long-term sustainability of the National Health Insurance Scheme. Thank you.
Yes.
Mr. Speaker, the lifting of the spending cap is expected to strengthen the long-term sustainability of the National Health Insurance Scheme by allowing a greater proportion of revenue raised for health insurance to be applied to the fund's obligations. It improves the fund's liquidity, reduces the accumulation of claims arrears, and enhances the ability of healthcare providers to continue serving National Health Insurance Scheme members. The additional resources have enabled the authority to prioritize claims payment and support essential medicines, vaccines, free primary health care, Ghana Medical Trust Fund, and other approved health interventions. The authority currently makes payment to service providers monthly, with the most recent payment made on 30th June 2026. Service and medicine tariffs have also been reviewed and will be implemented soon to improve the alignment between National Health Insurance Scheme reimbursement for claims and the cost for providing care. The uncapping also supports the scheme's sustainability by improving access to early and affordable care. Under the free primary health care, early detection and treatment of conditions such as hypertension and diabetes can reduce the need for more expensive emergency and specialist interventions. Increased confidence in the scheme has contributed to an increase in active membership coverage from 57% at the end of 2024 to 70% as of June 2026. Mr. Speaker, it is acknowledged that the Ministry of Health has introduced programs that place additional obligations on the fund. These are, however, health-related programs that form part of an integrated approach to health care financing rather than expenditures unrelated to the objective of the National Health Insurance Scheme. Mr. Speaker, the authority is strengthening claims management, utilization monitoring, provider audits, and expenditure controls. These measures are intended to ensure that the additional resources improve the timeliness of claims payments, protect access to care, and strengthen rather than undermine the financial viability of the scheme. Thank you.
Any further question?
Thank you, Right Honourable Speaker. That will be all for my colleague. Thank you.
Yes.
Thank you, Mr. Speaker. Mr. Speaker, can the Minister tell us the impact of the Ghana Medical Trust Fund, whose revenue falls with National Health Insurance, the impact on the campaign of the health insurance? Do you understand the question?
Honourable Member, the question is on lifting of the spending cap on the National Health Insurance.
Yes, Mr. Speaker. And we know that the Ghana Medical Trust Fund also hinges...
Any question relating to Ghana Medical Fund will not emanate from the original question.
Yes, the original question...
And it will offend Order 89.1. All members, let's move to question number 792. Standing in the name of Honorable Emmanuel Kwaku-Boem, Member of Parliament for Pro East.
Thank you very much, Mr. Speaker. I rise to ask the Minister for Health what medium to long-term plans the ministry has to expand health infrastructure and provide essential medical equipment in Riverine and other hard-to-reach communities so as to improve equitable access to quality health care across the country. Thank you very much.
Yes, Honorable Minister.
Mr. Speaker, the Ministry of Health remains committed to improving access to quality health care for people living in riverine, remote, and other hard-to-reach communities across the country. To achieve this, the Ministry is implementing the equipment retooling component of the free primary health care program. The first batch of 24,534 pieces of equipment the Ministry has taken delivery of has been supplied to primary healthcare facilities such as CHIPS compound, health centers, polyclinics, and district hospitals. The next batch to be delivered will be supplied to district hospitals. Mr. Speaker, His Excellency the President's policy directive of construction of 2 CHIPS compound each year by district assemblies has achieved over 400 number completed. Again, the Ministry has prioritized district without district hospitals by siting of health facilities in underserved areas. Mr. Speaker, the Ministry intends to undertake a nationwide assessment to identify infrastructure gaps across the country towards upgrading the existing data. These assessments will guide the planning and prioritization of new health facilities, upgrade of existing facilities, and provision of essential medical equipment, particularly in underserved communities. The Ministry also makes annual provisions under its capital expenditure budget for the retooling of health facilities and continues to leverage other funding sources, including development partners and special intervention programs, to support infrastructure expansion. Mr. Speaker, these measures are intended to ensure that all Ghanaians, regardless of where they live, have equitable access to quality healthcare services and that no community is left behind in our pursuit of universal health coverage. Thank you, Mr. Speaker.
Honourable Member, any supplementary question?
Thank you very much, Honourable Speaker. I want to seize this opportunity to thank the Minister for the very fair answer to my question. Thank you.
We move to question number 811, standing in the name of Honourable Benjamin Nate Aiku, Member of Parliament for Lojokuku.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister for Health the status of the tertiary nursing and midwifery training college hostel project and when the project is expected to be completed and handed over. Thank you, Mr. Speaker.
Yes, Honourable Minister.
Mr. Speaker, I wish to indicate that, yes, the hostel block construction project for the Teshi Nursing and Midwifery Training College in Lejokuku Municipality, Accra, is intended to address the accommodation challenges faced by students of the institution. The project commenced in February 2024 with the contractual duration of 24 calendar months for the construction of a 3-story hostel facility. I wish to state, however, that during the substructure excavation works, unforeseen ground conditions were encountered, which required excavation to a depth of approximately 6 meters before stable ground was reached. This development necessitated the revision of the foundation design from strip footing to a raft foundation, resulting in variations to the original contract sum. Notwithstanding these challenges, construction works progressed satisfactorily with key activities such as excavation, ground stabilization, reinforcement works, and foundation preparation completed. However, delays in payment to the contractor led to the suspension of works and the eventual abandonment of the site. Following the release of payment of the outstanding IPCs in February 2026, the contractor has remobilized to site for the construction works. Thank you.
Honourable Member, any supplementary question?
Mr. Speaker, the Speaker, I want to find out from the minister the new development that is taking place there, the new timelines for this completion, and then handing over.
Yes, Minister.
Mr. Speaker, the original duration of the contract is 24 months.
Any further question?
Mr. Speaker, thank you very much. That's all for.
Honourable members, this is a constituency-specific question. We move to 814, standing in the name of Desmond de Graaf, P2, Gomoa East. You have the floor.
Thank you, Mr. Speaker. I rise to ask the Minister of Health what measures the ministry has put in place to upgrade Nyenyano Health Center to a polyclinic due to the current rise of population in the community.
Yes, Honourable Minister.
Mr. Speaker, the Ministry of Health is aware of the growing healthcare needs of the people of Nyenyano and the surrounding communities in the Gomoa East District Assembly. Currently, residents have access to healthcare services through the Englishi Amanfum Polyclinic, Botiano Polyclinic, Kasua Polyclinic, the Mother and Child Hospital, and the Nyenyano Community Clinic, in addition to several private health facilities within the area. Notwithstanding these existing services, the ministry recognizes the impact of the area's increasing population on healthcare demand. Accordingly, the ministry will deploy a technical team to assess the capacity and service needs of the Nyenyano Health Center to determine the feasibility of upgrading it to a polyclinic. The findings of the assessment will guide future planning and resource allocation, including consideration in subsequent budget cycle. The ministry remains committed to improving access to quality health care and ensuring that health infrastructure keeps pace with the needs of our growing communities. Thank you.
Any supplementary question?
Thank you, Mr. Speaker. Minister, from your answers provided, I just want to find out, when will this technical team commence the operation and the timeline of completion of their result to enable what you talk about the national
Yes,
plan?
Honourable Minister.
Thank you.
Mr. Speaker, when we will start the assessment, before I came to the floor of the House, I had already instructed my technical team, the Director of Infrastructure, to act accordingly. Thank you.
Any further question?
Thank you, Mr. Speaker. I'd like to thank the Minister, and then...
This constituency specific will move to question number 815, standing in the name of Superintendent Retired Peter Lanchini, Wa West.
Mr. Speaker, I have the authority of the honourable member to ask a question on his behalf.
Please do.
Thank you. To ask the Minister for Health when the Agenda 111 hospital in Wechau, currently at an advanced stage of construction, will be completed.
Yes, Honourable Minister.
Mr. Speaker, the Wa West District Hospital, Wechau, in the Upper West region, is included in the Agenda 111 initiatives. Following the completion of the audit, the necessary stakeholders' consultation on the Agenda 111 program have been completed, and the ministry has developed a strategic implementation plan for the program. The consensus from the consultation is that the ministry should roll out the completion of the project in phases, based on level of completion, funding availability, and the needs of the various catchment areas. The phased approach is intended to ensure that the limited resources are used efficiently to complete and operationalize projects rather than spreading resources too thinly across too many sites. Mr. Speaker, the Wechau Hospital in the Wa West constituency is currently at approximately 52.84% completion, and the government will ensure that this project is considered under subsequent phase of the implementation program. Thank you.
Any supplementary question?
No, Mr. Speaker, that will be all. Thank you very much, Honorable Minister.
We move to question number 834, standing in the name of Honorable Richmond Adam Kofi Potosu. Yes.
Thank you, Right Honorable Speaker. Speaker, with respect, I have the authority of the member to seek your permission to ask the question on his behalf. I rise to ask the Minister for Health how the ministry is reconciling free primary health care and non-communicable diseases, NCDs, with the policy of using distance and population to cite CHIPS compound. Thank you very much.
Yes, Honorable Minister.
Mr. Speaker, the traditional CHIPS citing model allocates compounds based on population size between 3,000 to 5,000 and provides mainly basic curative and reproductive, maternal, newborn, child, and adolescent health care. Every community in Ghana already falls within a demarcated CHIP zone, and every zone has a community health officer responsible for it. In a CHIP compound where one exists, or the nearest health center or sub-district office where one does not exist, no community sits outside the system. Within the free primary health care, three design features ensure services including NCDs care, that's rich people, and the first one is the population-based payment allocates preventive care funds by population, adjusted for remoteness, dispersion, and difficulty of access. The secondly, NCD's care is delivered at the doorstep. Blood pressure, blood sugar, and BMI screening, risk counseling, medical health support, and breast screening are provided through daily home visits, outreach, and community debates with tasks shared across frontline staff, not held at a facility waiting for patients to arrive. Third, health posts close to the remaining gaps. New health posts serve market, lorry parks, and hard-to-reach areas expanding in phase 2. Rollout is equity first, beginning with the 150 most deprived districts. In summary, free primary healthcare does not replace CHIPS. It complements it. CHIPS remains the basic unit of primary healthcare, covering both clinical and public health functions. Previously, National Health Insurance reimbursement only clinical care for card-bearing members. Under free primary health care, all clinical services at the CHIPS are free to any Ghanaian, regardless of national health insurance status. And home visits, outreach, and debates are now delivered routinely at no cost to patients, households, or communities. Existing compounds are being retooled to the expanded free primary healthcare NCD service standard. And referral is formalized through primary care network linking CHIP zones, health centers, and polyclinics. In short, the ministry has redesigned both the financing and the service model so that free primary health care, especially preventive health services, travels to communities rather than waiting for community to travel to it. Thank you.
Any further question?
No, Right Honorable Speaker. Thank you and the Minister.
We move to question number 850, standing in the name of Honorable Eric Adam Agbana, Ketu North.
Thank you, Mr. Speaker, for the opportunity. Mr. Speaker, I rise to ask the Minister for Health what specific plans the ministry has to fully operationalize the Ketu North Municipal Hospital in Veta to ensure the facility becomes fully functional and accessible to the people of Ketu North. Thank you.
Yes, Honorable Minister.
Mr. Speaker, I wish to inform this Honorable House that Weta District Hospital was constructed under the government's project for the construction of 5 district hospitals at Weta, Tolon, Sola, Bupe, Somenya, and 1 polyclinic at Bamboy with a loan contracted by the government of Ghana. With Weta District Hospital was completed and officially handed over in 2021 and operationalized in 2022. Mr. Speaker, I wish to respectfully state that the Weta District Hospital has been operational for about 5 years and continues to provide healthcare services to the people of the Ketu North municipality and surrounding communities. The facility is currently staffed with 3 medical doctors among other healthcare professionals. Thank you.
Any supplementary question?
Yes, Mr. Speaker. Mr. Speaker, I respectfully want to find out from the Minister what plans the ministry has to ensure that currently we have only 28% of the staff available and some units of the hospital are not.
What is your supplementary question?
That is, I want to find out if the minister is aware that some units of the hospital are not functional or operational.
Yes.
Thank you, Mr. Speaker. Mr. Speaker, per the information available to me in terms of the unit infrastructure and equipment, I'm reliably informed that every unit of the facility should be in operation. Now, with respect to personnel, the workforce, Mr. Speaker, I would want my brother, the honorable member, to get in touch with me, and then we see how we can fix the deficiencies in the system. But for the information of the House, Mr. Speaker, we have, as a ministry, prioritized the underserved regions, underserved districts for the past 1.5 years. And so, Mr. Speaker, in 2024, only 6 health professionals were posted to that district. But, Mr. Speaker, in 2025, we posted 30 health professionals to that district. In 2026, the current ongoing recruitment, we have again posted 31 health professionals to that same district. And so, Mr. Speaker, I know my honorable brother is a very hard-working one, and so he should get in touch with me, and we'll see how we can fix his peculiar situation. Thank you.
Any further question?
No, Mr. Speaker, except to thank the minister for his hard work.
Honourable Minister, on behalf of the House, I sincerely thank you for attending upon the House to respond to 20 questions, or about 21 questions scheduled for you. We are most grateful for you coming. Accordingly, you are discharged. Yes, Majority Leader.
Mr. Speaker, we will take the Minister for Lands and Natural Resources, who also doubles as the Acting Minister for Environment, Science and Technology. But before we do that, Mr. Speaker, I crave your indulgence if we can vary the order of business and then order paper addendum 2. Let the Minister lay a paper before he starts answering the questions, and that is item number 1A on the order paper addendum, before he starts answering the questions, so that it can be referred to the committee to work. Which items? Yeah, and then when he finishes, he can lay on behalf of his colleague. But let him lay his first. Yeah.
Yes.
Mr. Speaker, we don't have a problem with the minister laying the paper.
Honourable members, at commencement of public business, order paper addendum 2, presentation of papers, item numbered 1A by the Minister responsible for lands and natural resources.
Mining lease agreement between the Government of the Republic of Ghana, represented by the Ministry of Lands and Natural Resources, and Demand Gold Mine Limited for the mining of gold in Lima South, 33.58 kilometers square in the Prestia Honey Valley district in the Western region.
Honourable members, the paper is duly presented and it is referred to the Committee on Lands and Natural Resources for consideration and report. Item numbered 1B.
No, not yet, Mr. Speaker.
Very well.
Yeah, Mr. Speaker, let's take order paper addendum, item number 1A. Item number 1A.
Yes. So for the Minister to lay it on behalf of the Minister for
1A, Roman numeral 1 and 1A, Roman numeral 2. The Minister will do that on behalf of the Minister for Roads and Highways, Minister for Lands and Natural Resources. He had assigned his deputy to lay on his behalf, but he just stepped out. So if we can have the Minister for Lands do that.
Yes.
Mr. Speaker, we don't have a problem with regards to the laying of that paper. So the Minister responsible for Environment, Science and Technology.
Yes.
Concession agreement between the Government of the Republic of Ghana and the Special Purpose Vehicle to be incorporated by the Rock Africa Limited for the implementation of the reintroduction of tolling of roads and bridges in Ghana project under the public-private partnership arrangement.
All members, paper duly presented. It is referred to a Committee on Roads and Transportation for consideration and report. Yes, Majority Leader.
Mr. Speaker, the Minister for Health also has some...
Well, they must lay the 2, II.
II, okay.
Proposed formula for the distribution of the Road Maintenance Trust Fund for the year 2026.
All members, paper duly presented as in item number 1AII on order paper addendum at page 1, and it is referred to a Committee on Roads and Transportation for consideration and report. It's referred to the Committee of the Whole for consideration and report.
Mr. Speaker, the Minister for Health, with your indulgence and the concurrence of my colleagues opposite, may lay the papers itemized 8A, B, and C in the main order paper, page 8, item 8A, B, and C.
Yes.
Mr. Speaker, he can do so, but the Majority Leader, if you can give us reasons why we don't have the Minister responsible for Interior in the chamber and that of Fisheries and Aquaculture.
I know Fisheries is out of the jurisdiction. The Interior has some engagements. He will be in the House later, but he would have come too late. But I just want us to get it off the way so that we can continue.
Yes.
Mr. Speaker, respectfully, I want to find out from the Majority Leader, is the Minister of Interior dealing with the issues of recruitment? There are about 506,000 recruits who have not been successful.
Honorable
Is that the
Jerry
reason why it's not
Amechai,
here?
please, you are out of order.
About 506,000.
Please, you are out of order.
Mr. Speaker, the minister responsible for health can lay the papers on behalf of the minister.
Yes, minister responsible for health. Item numbered 8A.
Annual statements by the Audit Committee of the Ministry of the Interior for the year ended 31st December 2025.
Honourable members, the paper has been duly presented. It is referred to a Committee on Defence and Interior for consideration and report. Item numbered 8B.
Budget performance report in respect of the Ministry of Fisheries and Aquaculture for the period January to December 2025.
Honourable members, paper has been duly presented. It is referred to a Committee on Food, Agriculture and Cocoa. It's referred to the Committee on Food, Agriculture and Cocoa Affairs for consideration and reports. Item numbered 8C.
Annual statement by the Audit Committee for the Somenya Polyclinic for the year ended 31st December 2025.
Let's take all together.
Annual statement by the Audit Committee for the Yellow Korobo District Hospital for the year ended 31st December 2025. Annual statement by the Audit Committee for the Yellow Korobo Municipal Health Directorate for the year ended 31st December 2025. Annual statement by the Audit Committee for the National Vaccine Institute for the year ended 31st December 2025. Annual statement by the Audit Committee of the Tamale Teaching Hospital for the year ended 31st December 2025. Annual statement by the Audit Committee of the Maternal and Child Health Hospital Kumasi for the year ended 31st December 2025. Annual statement by the Audit Committee of the University of Ghana Medical Center for the year ended 31st December 2025. Annual statement by the Audit Committee of the National Blood Service, Ghana for the year ended 31st December 2025. Annual statement by the Audit Committee of the Ghana AIDS Commission for the year ended 31st December 2025.
Honourable members, the papers numbered item 8C, I to IX, have been duly presented and they are referred to the Health Committee for consideration and reports. Item numbered 8D. Chairman of the committee.
Mr. Speaker, we are not taking 8D yet.
Very well.
The reports are not ready. So we can now go back to questions so that the acting environment minister can answer questions itemized 336, 337, 338, 339, 340, 341.
Very well. May I handily invite the minister to take the designated seat? Whilst I call on the questioner of question number 336 in the person of Honorable Gloria Owusu, Member of Parliament for Trobu. Yes. Honourable members, the answers to all those questions are provided in the order paper addendum. Please, you have the floor.
I'm grateful, Mr. Speaker. Mr. Speaker, I've been authorized by the Honourable Gloria Owusu to ask question 336.
Yeah, please go ahead.
I rise to ask the Minister for Environment, Science and Technology how the newly passed Environmental Protection Authority Act 2025, Act 1124, is being operationalized and what institutional changes will take place at the EPA to enhance enforcement.
Yes, Honourable Minister.
Thank you, Honourable Speaker. The Ministry continues to advocate for greater investment in research, utilization, across all sectors, ongoing science, technology, and innovation, STI, governance reforms, including operationalization, the National STI Policy and Implementation Plan, are helping institutionalize research uptake as a core outcome of government-funded research. Cabinet has approved the revised National Science, Technology, Innovation Policy, which provides the overarching framework for strengthening research, technology development, and innovation in Ghana. The Ministry is preparing to launch, disseminate, and implement the policy to embed STI in national development and sectorial programs. The Ministry is also strengthening institutional arrangements for coordinating technological development, innovation, technology transfer, and commercialization across the country. The following are some of the specific measures that have been implemented. One, the launch of the biannual Environment, Science and Technology BEST Forum, a platform for the exhibition of technical innovation, solutions, and ideas and startups from scientists, researchers, and institutions. Two, development of the National Research and Commercialization Policy to help bridge the gap between research and industry. Three, the Ministry has established the Ghana Innovation and Research Commercialization Center, GEC Center, to bridge the gap between research and industry, connecting researchers and innovators with businesses, investors, and financial institutions to turn promising research into commercially viable products and enterprise. The Ministry Visible Webinars, which is a platform to create awareness and showcase technological innovation. 5, coordination with ministries, departments, and agencies in the areas of biotechnology, agro-processing, energy, manufacturing, health, nuclear application, and environmental technologies for the promotion of science, technology, and innovation for socio-economic development. So, Speaker, the Ministry is fostering stronger partnerships among investees, research institutions, innovators, industry, and investors to ensure that research and technology respond to the needs of the productive sectors of our economy. I thank you.
Any supplementary question?
There will be no supplementary question. However, the question answer given by the minister is different from what was produced in the order paper. I must also admit that it's a very comprehensive answer, and I'm satisfied with that. May I be given a copy of your answer, since I don't have that in the order paper?
Very well, Minister.
Madam Speaker, I think we informed the honourable members that the correct answer is in Addendum 2. So that has been corrected, and that's why probably there.
Yes, I announced from the beginning that the answer to the question are in order paper addendum. So we shouldn't look at the original one. Honourable members, let's move to question number 337, standing in the name of Honourable Shadi Aye. Echima Mobiaja South. You have the floor.
Thank you, Mr. Speaker. I have the authority for my honourable member to ask the question on my behalf.
Please do.
Thank you, Mr. Speaker. Before the question, the name is Shirley Che. The Che is wrongly spelled, so if it could be corrected.
Very well.
Mr. Speaker, I rise to ask the Minister for Environment, Science and Technology what implementation plan exists for the One Child, One Tree initiative, and how schools across the country will be resourced to participate in the program.
Yes, Honourable Minister.
Thank you, Madam Speaker. Following the President's launch of the Initiative on World Environment Day in 2025, the Ministry, the Forestry Commission, and the Ghana Educational Service structured implementation around these phases, sourcing and allocating seedlings to ecological zone, training teachers and environmental officers to supervise planting and monitoring and nurturing seedlings through the school term. Schools are resourced through the EPA and the Forestry Commission's regional and district offices, who serve as collection points where head teachers and parent-teacher associations can obtain seedlings, planting guides, and basic tools free of charge. The EPA and the Forestry Commission staff train teachers and pupils in planting and aftercare, and district education officers have been designated a focal teacher in each school to coordinate the exercise and report on seedling survival. This builds on the wider Tree for Life program, under which Ghana restored 23,600 hectares and planted over 30 million seedlings in 2025, creating more than 41,000 jobs. Its second edition, Team Forests and Economies, was launched in March 2026, targeting a further 30 million seedlings, with schools again prioritized as key delivery points. Honourable Speaker, the Ministry will continue working with the Ministry of Education and the Forestry Commission and the district assemblies to ensure every school, particularly in rural and peri-urban areas, receives the seedlings and support needed to participate fully in this program. Over the years, the EPA has collaborated with schools through the Ghana Educational Service to plant and nurture trees on all World Environment Days. The EPA has also introduced Forum on Environment and Climate Change to build their capacity in support of education on environment and climate change. I thank you.
Any supplementary question?
Thank you, Mr. Speaker. Mr. Speaker, the Honourable Minister has indicated that EPA, the Forestry Commission, the Ministry of Education, and the Ghana Education Service will all play roles in implementing the initiative. Which institution bears the ultimate responsibility for ensuring that planted trees are maintained in schools, and what resources have been provided to schools to support watering, protection, and replacement of seedlings that do not survive?
Yes, Minister.
Thank you, Honourable Speaker. This is a very important question. There's a collaborative effort, as I've stated, between the EPA and the Forestry Commission, working with the Ghana Educational Service. The EPA will be providing the seedlings with the Forestry Commission, training teachers and coordinators at the district level. But ultimately, those who are trained are responsible for engaging the students and making sure that they build through the school system a habit of protecting and nurturing the trees. I thank you.
Any further question?
Thank you, Mr. Speaker. I would like to find out from the Minister exactly what has been done or achieved since its launch in June 2025.
Honourable, your question is for him to come and tell you the implementation plans. And he has given you the implementation plans, and that sufficed. Your supplementary question must originate from the original question. Any further question?
Thank you, Mr. Speaker. No supplementary question.
Very well. Move to question number 338, standing in the name of Honourable Rudolph Amako Jamra, Upper Dentra, West.
Thank you, Honourable Speaker. Mr. Speaker, please, I would like to correct the name. It's not Jamra, it's Jampa. So table office, just take notes. Jampa, not Jamra.
Very well.
Yeah. Mr. Speaker, I would like to ask the Minister for Environment, Science and Technology how the ministry plans to scale up the CEF-PS project beyond the initial pilot SMEs, and what national target exists for reducing non-biodegradable plastic waste. Thank you.
Yes, Honourable Minister.
Thank you, Honourable Speaker. The Circular Economy Framework for Plastics, CEF-PS project, has engaged 11 SMEs so far outside its initial scope which included Greater Accra, Eastern, Central, and Northern regions, broadening the pool of businesses able to benefit from its resource and expertise. An open invitation process will target businesses in the remaining regions, which are Ashanti, Volta, Bono, Ahafo, Oti, Western North, not covered on the original selection, giving newly invited SMEs the opportunity to participate as pilot enterprises. A core objective is to drive behavioral change around plastic use, with pilot SMEs demonstrating how plastic waste can be converted into valuable products such as school desks and other furniture to inspire wider adoption of sustainable practices. The project will also train about 2,000 stakeholders across the plastic value chain. The following are the measures intended to reduce biodegradable plastic waste. Subsequent to the President's announcement on the ban on the use of polystyrene foam products starting from June 5, 2025, the EPA announced in May 2026 a ban on the importation, production, sale, and use of the polystyrene foam products by 1st January 2027. Extensive engagements are being carried out with the stakeholders in the value chain to prepare them for the transition. A campaign to create awareness and educate the general public and all stakeholders was launched on July 28, 2026. That's just yesterday. The authority is also implementing a plan to phase out single-use plastics in Ghana within the next 2 years. I thank you very much.
Any supplementary?
Yeah, thank you, Mr. Speaker. Mr. Speaker, in Minister's answer, he indicated in line with the allocation, the project will initiate an open invitation. Can the Minister indicate when the invitation process is going to be done for the SMEs?
Yes, Honorable Minister.
Honorable Speaker, in my answer, I listed the regions that has already been tackled and stated that the new regions that are listed.
Mr. Speaker, I rise to ask the Honorable Minister for Environment, Science and Technology what specific support will be provided to the 11 SMEs selected under the Curricular Economy Framework for the plastic sector CEF-PS project, and how their performance will be monitored. I thank you, Mr. Speaker.
Yes, Honorable Minister.
Honorable Speaker, let me state that this question was referring to 2025 action. So this is the context in which I answer. In 2025, the ministry disbursed 331 million to 10 beneficiary SMEs. They include Coliba Waste Management Services, Macintosh Africa, Neplas Eco Ghana Limited, and Zoomlayo Integrated Recycling and Compost Plant, among others, under the pilot phase of the Circular Economy Framework for the plastic sector. The project trained and selected SMEs in best practices for plastic waste collection, processing, upcycling, and product development. To ensure effective accountable use of funds, the project has set disbursement conditions for all participating SMEs, promoting transparency, compliance, and alignment with this objective. A monitoring and evaluation framework is also in place, requiring quarterly financial technical reports that track fund utilization, progress, and challenges encountered. I thank you.
Any supplementary?
Most grateful, Mr. Speaker. Mr. Speaker, I would like to find out from the Honorable Minister if the periodic monitoring and evaluation that has been done illustrates a very successful outcome of the project. I thank you, Mr. Speaker.
Yeah, Minister.
Indeed, Right Honourable Speaker, there's a lot of progress being made, and it's visible even around a lot of the cities, especially because plastic cups, plastic bottles are now have monetary value. And you see women picking, and a lot of people have turned it into businesses because they have value, and it's having a real impact. And so that is the motivation that keeps us going on this program. I thank you.
Mr. Speaker, that will be all. I thank you.
Very well. Let's move to question number 340. Standing in the name of Honorable Professor Kingsley Nyako, Member of Parliament for Kwadaso. Yes, you have the floor to ask the question, Professor Kingsley Nyako.
Mr. Speaker. So, question number 340. I rise to ask the Minister for Environment, Science and Technology for the specific measures the ministry has taken to promote technological innovation in the country. Thank you.
Yes.
Thank you, Honourable Speaker. The ministry continues to advocate for greater investment in research utilization across sectors. Ongoing STR governance reforms, including operationalizing the National STR Policy Implementation Plan, are helping institutional... I've answered this question. Okay. Cabinet has approved the revised National Science, Technology, Innovation Policy, which provides the overarching framework for strengthening research, technology development, and innovation in Ghana. The ministry is preparing to launch, disseminate, and implement the policy to embed SCI in national development and sectorial programs. The ministry is also strengthening institutional arrangements for coordinating technological development, innovation, technology transfer, and commercialization across the country. The following are some of the specific measures that have been implemented. The launch of the biannual Environmental Science and Technology Forum, a platform for the exhibition of technology innovation, solutions and ideas and startups from scientists, researchers, and institutions, the development of the National Research Commercialization Policy to help bridge the gap between research and industry. The ministry has also established the Ghana Innovation and Research Commercialization Center to bridge the gap between research and industry. The ministry is also has also what we call the Visibility Webinars, which is a platform to create awareness and showcase technological innovations. We are also coordinating with ministry, departments, and agencies in the areas of biotechnology, agro-processing, energy, manufacturing, health, nuclear application, environmental technologies for the promotion of science, technology, and innovation for socio-economic development. So, Speaker, the ministry continues to foster stronger partnerships among universities, research institutions, innovators, industry, and investors to ensure research and technology respond to the needs of the productive sectors of our economy.
Any supplementary question?
Mr. Speaker, I want to commend the Minister for this comprehensive response. However, I want to find out from him the time frame, if any, to complete the National Research Commercialization Policy. Thank you.
Yes.
I said I wanted to find out from you.
Yes.
That,
I'm posing the question to the minister.
No, because he didn't hear me properly.
Very well. You may repeat your question.
My question is that, what is the time frame within which you intend to complete the National Research Commercialization Policy? Thank you.
Yes, Honourable Minister.
Honourable Speaker, the ministry aggressively continues to ensure that the Innovation and Research Commercialization Center especially reaches out and bridges the gap, as I've stated. And the target is that within 2 years, we should make a lot of progress. I thank you.
Any further question?
Mr. Speaker, the partnership with the ministries and other agencies, I want to find out from you that with these elaborate responses, which of the ministries did you engage?
Please, your question is on specific measures, and the minister has told you the specific measures.
Yeah, the measures, I'm thinking that, for example, you would deal with the education ministry, other ministries to
But
come up with the measures.
that is your thinking. We should be careful not to violate Standing Order 88.7.
Mr. Speaker, there's no violation, but I hear you. Thank you.
We move to question number 341, standing in the name of Professor Kingsley Nyako. You have the floor.
I rise to ask the Minister for Environment, Science and Technology the specific plans and interventions that the ministry has taken to promote and ensure environmental sustainability in the country. Thank you.
Yes, Honorable Minister.
Thank you, Madam Speaker. The Ministry oversees Ghana's national environment policy, promoting sustainable development through environmental protection, resource conservation, and ecosystem integrity, and ensures regulatory enforcement, policy implementation, and climate initiative through these agencies. Plastic waste management, the circular economy, the Ministry is implementing the National Plastic Management Policy, which aims to reduce plastic pollution, promote reuse, and encourage a circular economy. Interventions include buyback centers within project areas, extended producer responsibility legislation for plastics and other packaging, and a multi-stream e-registry system for data management and reporting on plastics and electronic equipment. Through the West Africa Coastal Area Resilience Investment Project, WACA, the Ministry is investing in physical, social, and nature-based solutions to protect against coastal erosion and flooding. The Environmental Protection Agency has also implemented a number of actions to ensure environmental sustainability, and they include requiring all development projects to be subjected to environmental assessment as required under Act 1124 and LI 2504 prior to the commencement of construction and operation to minimize environmental and climate change impacts. 2, collaborating with MMDAs has mainstream environmental issues into national policies, plans, and programs to ensure sustainability. I was collaborated with the National Development Planning Commission to mainstream sustainability into the national planning framework in line with the SDGs. They are also working to ensure that all permitted undertakings comply with environmental quality standards, that is air, noise, and affluent, and has requested high polluting undertakings to install real monitoring system under the Ghana Online Continuous Emissions Monitoring System, GOSEMS, agreement. They are also conducting air quality monitoring in Accra and other major cities and monitors and regulates industrial emissions, noise pollution, and water quality standards. They are also lastly training of stakeholders on sustainable consumption and production. Madam Speaker, EPA, as you know, also announced in 2025 a ban on importation, production, sale, and use of polystyrene from foam products by the 1st January 2027. Extensive engagements are being carried out with stakeholders in the value chain to prepare them for the transition. A campaign to create awareness and educate the general public and all stakeholders was launched just yesterday. The authority is also implementing a plan to phase out single-use plastics in Ghana. Speaker, through these policies, projects, and partnerships, the ministry is steering Ghana towards an environmentally sustainable future, protecting natural resources, building climate resilience, promoting green innovation, and embedding environmental consciousness across generations. I thank you.
Any supplementary question?
No, please.
We move to question number 389, standing in the name of Ida Ajua Asiedu.
Thank you, Mr. Speaker, for the opportunity. I rise to ask the Minister for Environment, Science and Technology the steps the ministry is taking to address the environmental impact of sand winning within the Krabua Kota district in Ayeswado. Thank you.
Yes, Honorable Minister.
Thank you, Honorable Speaker. The EPA with the Ayeswado District Assembly has acted to control illegal sand winning. In January 2024, the Assembly imposed a temporary ban on sand winning in the district to regulate the activity, safeguard the environment, and foster community harmony. Through community education, the EPA continues to highlight the dangers of sand winning to inland and coastal communities, the environment and public health safety. Honourable Speaker, I'm happy to announce that the EPA has created a new district office in Suhum, in response to the growing environmental challenges within its catchment areas, especially to focus on the menace of sand winning. The EPA is also promoting sustainable alternatives to sand, such as crushed rock, clay, recycled plastic blocks, and containerized housing, with public education on these alternatives, which are ongoing. I thank you.
Any supplementary question?
Thank you, Mr. Speaker. I thank the Minister for his response. I don't have any supplementary question. Thank you.
Thank you. To move to question number 567, standing in the name of Professor Hansa Adams, Member of Parliament for Kumbugu.
Thank you so much, Mr. Speaker. Mr. Speaker, I want to seek your leave to abandon question number 567 because it's very similar to question number 337, which the Minister has already done.
Very well, then we then move to question number 568. You have the floor then.
All right. I rise to ask the Minister for Environment, Science and Technology what steps the Ministry will take to stop the high attrition rate in research and science agencies in the country.
Yes, Honorable Minister.
Thank you, Honourable Speaker. The Ministry recognizes that high attrition among scientists, researchers, and technical professionals challenges the capacity of our research and science agencies to support annual development, and will work with relevant institutions to improve the attraction and retention of skilled scientific personnel. The Ministry will engage government institutions, governing boards, and organized labor to improve conditions of service, career progression, and incentives for scientists, researchers, and technical personnel within the broader public sector compensation framework. We also work to promote sustainable research financing through the Ghana National Research Fund, while mobilizing additional resources to upgrade and modernize labs, equipment, and other research infrastructure. 3, to expand specialized training, fellowships, joint research, mentorship, and participation in international scientific networks, enabling researchers to gain global experience while maintaining strong links with Ghana's research institutions. Also, work to increase investment in research and development through sustained funding for research projects. And 5th, to strengthen career development and retention programs by providing clear career progression pathways and supporting capacity development. 6th, we focus on implementing targeted incentives for critical skills in areas such as nuclear science, engineering, biotechnology, radiation protection, among others. And lastly, to enhance partnership and resource mobilization. Also to state that the government's 20-hour economic policy presents a unique opportunity to reverse high attrition by positioning research institutions as key drivers of productive, innovative-led economy. Under the policy, research agencies will be encouraged to extend lab, testing, certification, and technology transfer services beyond the traditional working day, enabling them to generate additional internally generated funds, support industry operating around the clock, and create opportunities for performance-based incentive for researchers. I thank you.
Any supplementary question?
Yes, please, Mr. Speaker. I want to find out from the Minister what the short to medium-term strategy is, since it is a serious challenge among the science institutions.
Yes.
Honourable Speaker, in my answer, the 7-point plan that I've laid contains the long, short, medium, and long-term strategy. I thank you.
Any further question?
No further supplementary. Thank you so much.
Speaker, I'm on my feet.
Yes.
Mr. Speaker, the good minister intends seeking appropriate government institutions to ensure an enhancement of the conditions of service of these scientists and researchers. I want to find out from him what is the intended time frame within which to engage these agencies to ensure that he expedites
yes,
the
Minister,
implementation of this.
time frame.
Thank you.
Our Speaker, this is an ongoing activity, and we are seriously engaged with a lot of the agencies I've mentioned. I want to also let you also note, we are not also focusing just on attrition and creating the conditions of service, but we also see clear shortages of scientists that we are working with the Ministry of Finance to replace. This year, for example, in the budget, we've requested for recruitment of 400 scientists. We are still engaged with the ministry. So this area is a very important area for the ministry. I thank you.
Honourable members, question time is ended. Members, my attention has been drawn to the fact that question 813 has not been taken. It's standing in the name of Duke Williams, Elaine Kwame Yamakwata Oforiata. You have the floor.
Thank you, Mr. Speaker. Mr. Speaker, I rise to ask the Minister for Environment, Science and Technology what control measures measure mercury and cyanide use in artisanal mining and which sites are being inspected?
Yes.
Thank you.
Thank you, Honourable Speaker. Through the EPA, the Ministry inspects large, medium, and small-scale mining operations to ensure valid environmental permits in compliance with operating standards and tracks mining companies' compliance with management plans on toxic discharges, land degradation, and water pollution. This year, the EPA embarked on nationwide monitoring to clamp down on unregulated gold leaching, enforcing new environmental standards to curb hazardous effluent discharge, soil contamination, and pollution of critical water bodies in mining communities. Under the African Environmental Health and Pollution Management Project funded by the World Bank, the EPA has constructed a clean mining demonstration center to train artisanal and small-scale miners on clean mining. Our Speaker, in line with the Minamata Convention on Mercury, the EPA controls toxic chemical use in artisanal gold mining through National Action Plan, stricter chemical registration, and the promotion of mercury-free tools aiming to eliminate mercury and cyanide use from all artisanal gold mining sites. I thank you.
Any further question?
Yes, please. I rise to ask the Minister to involve members of Parliament in the affected areas in the steps being taken to protect communities and water bodies from contamination caused by mercury and cyanide use in mining.
Honourable, that is not a question.
Yes.
That's not a question.
May I ask?
It's a suggestion, at best, that ministers should involve members of Parliament. Is that not so?
Yes, please.
And so how could this be a question?
I want to find out, please.
You want to find out whether he's involving them?
If he would involve them, yes. Involve us.
Yes.
I'm in the mining district.
Honourable Speaker, Parliament already has supervisory authority over these ministries. And so Parliament is deeply involved through the Speaker's Committee on Environment, Science and Technology. But I'll be happy to engage and do anything if members of Parliament want to be even more involved.
Honourable Member, you need no invitation to exercise your oversight responsibility. Any further question?
No, please. Thank you, Mr. Minister.
And that brings us to the end of question time. Honourable Minister for Lands and Natural Resources, and Acting Minister for Environment, Science and Technology, we are most grateful for you attending upon the House to respond to questions scheduled for you. You are accordingly discharged. Yes, Majority Leader. Majority Leader.
Thank you very much, Mr. Speaker. Mr. Speaker, I wanted to sought your permission to vary the original order paper and take item number 41 on page 17 of today's order paper.
Yes. Yes, we are taking item numbered 41. Chairman of the committee.
Mr. Speaker, I rise to move that this Honorable House adopts the report of the Committee on Gender, Children and Social Protection on the annual statement by the Audit Committee of the Ministry of Gender, Children and Social Protection for the year 2024. And Mr. Speaker, in doing so, I present your committee's report. Mr. Speaker, I'll quickly touch on key portions of the report, and I urge the table office to capture the report in its entirety. Mr. Speaker, the Audit Committee reported several financial and administrative irregularities during the period under review. The committee observed that these findings were recurrent in nature and cut across the Ministry of Gender, Children and Social Protection, namely the Head Office, Department of Social Welfare, Gender Department, Child Development Department, and the Department of Community Development. Mr. Speaker, the committee is of the view that sustained management, commitment, effective implementation of audit recommendations, adequate resourcing, and continued engagement with the audit committee and the internal audit unit will enhance accountability and support the ministry in the effective discharge of its mandate of promoting gender equality, child protection, and social welfare in Ghana. Mr. Speaker, respectfully submitted.
All members, motion move report presented. Any seconder? Yes, you have.
Speaker, I have not cited a copy of the report. I have been checking to see. I don't know if now you have uploaded it, but I haven't cited a copy. I can't see.
But the report has been on the console for some time now. You cannot see. Is anybody ready to second the motion? Yes.
Thank you very much, Mr. Speaker. Mr. Speaker, I rise to second the motion to adopt the report of the committee, the Standing Committee on Gender, Children and Social Welfare, on the 2024 Audit Committee reports on the Ministry of Gender, Children and Social Protection. Mr. Speaker, in seconding the motion, I would just like to emphasize some of the issues that the chair of the Gender Committee has raised, and which borders on financial irregularities in state institutions. Mr. Speaker, it might be the report of the Gender Ministry, but we know that some of these infractions cut across a lot of our state agencies. When resources are released and allocated to ministries and agencies, they are meant for bridging the gap between those who have and those who don't have, providing amenities, bridging the poverty gap, looking at the social intervention programs of the ministry. So if resources are found to be inadequately allocated or inadequately authorized of expenditure, it poses a problem for the general well-being of the women and children that the ministry overseas. So we'll urge the ministry to take a look at the recommendations in the report and tighten its internal controls to ensure that expenditure is properly regulated within the ministry. I thank you, Mr. Speaker. Thank you.
Honourable members, motion moved and seconded. It is for the consideration of the House. Honourable members, at the conclusion of the debate, the question is as many as are in favour of the motion say aye. Those against say no. The ayes have it. The motion is adopted. Yes, Deputy Majority Leader.
Thank you very much, Mr. Speaker. Mr. Speaker, we want to look at, again, varied to item number 8 on page 8 of today's other paper, but we take E.
Item number 8E, 8F, but he said E. Yes.
Speaker, please let me make this point again, and respectfully I do so. Speaker, I've always believed that as leadership, when we ask for hard copies of reports, Speaker, I see no reason why that should be a problem. And Speaker, I feel very hurt that I say I can't see and you take it differently. Respectfully, I see no reason why it should be. I have not seen any report and its copy for me to even contribute. And Speaker, we are here representing the people. If the reports come to us, we will also contribute. And that's the essence for which we are here. So, Speaker, I have not done anything wrong.
Honourable members, if you want to cease in our effort to go paperless, let's say so.
Speaker, yes, I do not want
because
to cease in the effort.
Because when we agree that they should be putting the reports on the console, and it has been on the console, I don't expect any member to get up to say that I have not seen the reports. Yes.
Mr. Speaker, yesterday we took a decision to take that very report. So copies were shared among members. Maybe he did not keep track of his copy. Yes, yesterday we gave copies. Yes.
Honourable members, item numbered 8F. Chairman of the committee.
Report of the Joint Committee on Foreign Affairs and Regional Integration, Gender, Children and Social Welfare, and the leadership of the Committee on Constitutional and Legal Affairs on the African Union Convention on Ending Violence Against Women and Girls.
Honourable members, the report has been duly presented. It is for distribution to honourable members. Yes, majority, Deputy Majority Leader.
Thank you very much, Mr. Speaker. Mr. Speaker, with your pleasure, I wanted to reverse back to the mid-year budget commentary, which is item number 7 on the original of the paper. Thank you.
Honourable members, item number 7, statement. Yes.
Speaker, I was thinking that I engaged my senior colleague that if most of our colleagues have gone out to have lunch because we didn't finish early yesterday. So if we could take just about 10 minutes suspension and get them in, I mean, that is subject to your further instructions. And I thought you had agreed. So then we can come and take the statements or the comments.